Good evening, everyone in the room, everyone online, Facebook Live, and on YouTube via the live stream. Welcome to December's Lung Cancer Living Room, our patient roundtable holiday celebration. We're so happy to have you all here. I thought I would start, per David Leduc, who suggestion tonight, with a fun little fact about the living room. Tonight marks the 157th living room.
Wow.
That we have been able to bring to everybody.
That's
so
a lot.
Really, it is a lot, right?
That's a lot of LRs.
Yeah, so we're really excited to end the year on such a big number. It was something that, although we track on an annual basis, we hadn't cumulatively sort of put it together. So
What is that divided by 12? Any math people in here? Quick.
I don't know, it's a lot.
How many years
It's
is it?
at least 12 a year, and we just... Yeah,
Okay,
and then we have the regional living rooms that.
And now we're doing remote ones. So,
yeah,
okay.
yeah. So we're really excited. Tonight, for those of you who have participated in the end of year holiday celebration before, you sort of know what to expect. For those of you who have not, we're going to do around the room like we do during the regular living rooms. Although we're going to take it into a little more detail. I tend to, not on purpose, but sometimes rush everyone through their introductions, who they are, you know, when they were diagnosed, what they were diagnosed with, and then we sort of move on. But tonight I want everyone to feel free to dig a little deeper, to talk about whatever you want to talk about, whatever might be top of mind, and really whatever you may want to share about your story thus far. And that goes for family members, caregiver, industry, and others in the room, why lung cancer matters to you. And since the Hilliards have joined us from so
far away.
Oh, what I'm also going to do, and I need to actually write this into my scripting of the agenda, is introduce myself. I know most of you know who I am, but some people actually go back and watch this for the first time. So I'm Danielle Hicks, and I oversee patient programs and services here at the Bonnie J. Area Lung Cancer Foundation. I'm also one of Bonnie's daughters. The other one is in the back of the room.
The younger one's in the back of the room.
And the younger one is in the back of the room. So it is my great pleasure to be able to work on this program as well as others throughout the year, to be able to bring patient services, support, and education to all of you and your loved ones. And then, who are you, for those who might not know? I don't know that.
I'm the elder's mom and the young one's mom. And I'm Bonnie, and I'm a 14-year lung cancer survivor.
And now I'm going to move to the Hilliards because they did drive from quite a distance to come and be here with us.
Right.
It's in. I can't remember.
It's
it is a lake. Yeah. Almanor.
Lake Almanor.
Okay.
You know where that is?
No.
Hour and a half northeast of Chico.
Yeah.
We're above the
it's far.
fire, the bad fires.
Far.
Okay.
It's far. It's about 4 hours.
Yeah.
5 hours.
Okay.
Yeah.
Okay.
So, but we're here. But we have a house in Santa Clara, so we could go stay there.
Okay.
We haven't been here in some time, I would say. And I just decided the year that my husband found you was when I was having my lung surgery. He found you through Stanford, and that was 12 years ago.
Yeah. And look where you are now.
And look, I'm still standing.
Yep.
That's right. So I'm Jane. Do you want me to talk?
Yes.
Of course, I want you to talk.
My name is Jane Hilliard. This is my husband, Reed. As I said, we live at Lake Almanor. I was diagnosed in August of 2011. I have stage 4 non-small cell adenocarcinoma. So I had a bunch of the bad chemo, as you all know. You know, lose the hair, everything. And then I started on my Avastin, my maintenance drug, in May of 2012. So I've been on Avastin ever since then. And my oncologist finds it pretty hard to believe that I'm still on this. I've done so well that they've reduced the dose in half. They've moved my scans to every 4 months versus every 3. So I've been doing pretty well. I had some side effects, some bad stomach ache, those kinds of things, not awful. She said that, my oncologist said they usually last, Avastin only lasts usually for people about 1.5 years because of the side effects. But thanks to Bonnie, she put me in touch with Dr. Greg Olson, who is a homeopathic doctor. He was an MD, but then he went into the homeopathic medicine, and we've been going to him since 2012. And he does a lot of this testing. And what he does, he's not trying to cure me, obviously, but he gives me enough remedies based on my testing to help my side effects and help all the organs be calm. And I can't tell you, I've been. Now, of course, the doctors aren't going to tell you that's what's helping me, but
Right.
but they don't know anybody that's been on it this long. So he's really good, and I thank him and you, because I've been doing pretty well.
And you know, this isn't a commercial for him, but
No, it's not.
What he does is he keeps you just very fit. He makes sure that all of your vitamins are where they're supposed to be, and you know that you're doing some chelation, which is to just kind of wash your body out, you
Right,
know, once a month
right.
or whatever to get all those toxins out. And you know, so it's not voodoo.
No.
And you know, a lot of MDs do this, but you know, who knows?
And as my husband says, it doesn't work for everybody,
Right.
but I think it's helped me tremendously. I feel pretty good, and you know, once in a while I'll get some little thing, but I'm generally fine. So
And quite
sometimes I
frankly, we
ask
should
if
all
I.
take care of ourselves like
That's
that.
exactly right. Sometimes I
We
say,
should.
"Are you sure I have this?" And they go, "Yeah, we think you do."
Right.
So, do you want to say something?
Yeah.
Jane, I have a question before you.
Sure.
So, are your scans? What are your scans? How often are you being scanned currently?
I'm scanned every 4 months at Stanford, and my oncologist is Dr. Heather Wakely. And it's just the chest to abdomen scan, and it hasn't changed in 6.5 years. It'll be 7 years in May that I'll be on the same drug.
Yeah.
So, pretty amazing.
Yeah.
And I think it's important information. It's important to note too, when we're talking about hope and some of those things, because I know quite often we hear about people with either EGFR or ALK or ROS1 being on drugs for that amount of time, right? And understanding that this is not one of those drugs that targets a specific marker, but for some people,
Yeah.
it still can work for a really long time.
And these are the kind of people that we want to create clinical trials about. They're called outliers. They're called people that are surviving on a specific remedy much longer than anybody ever thought that was going to happen. And already lung cancer is, you know, divided up by markers and all these various different things. And you know, a lot of this care will last, survival will last 6 months, 11 months, 12 months, whatever. But then there's the people that progress rapidly, and then there's people like Jane that you know are, you know, doing really, really well. And those are the kind of clinical trials that we need data on to make more Janes and you know, more people like that. Right.
And yeah, for sure. And I want to remind everyone in the room that we aren't the only ones that get to interject. If there's something you want
Right.
to ask as someone is speaking, please feel free.
Yep.
So, Reed.
Yeah, she clearly is an outlier. That's what Heather refers to her as an outlier.
Yeah.
And I am her lesser half. My name is Reed. And just a couple comments. We are so fortunate to be here. I attribute it to a handful of things. Number one, we were very fortunate that she was diagnosed early, which was very, very helpful. We've had fantastic medical care with Heather and the medical team at Stanford. We have these guys to thank for a whole lot. But I think they did more for me than her. But and she has an unbelievably positive attitude about everything. Nothing gets her down for very long. She just moves on. And finally, we, you know, for better or worse, we think the homeopathic approach has helped her a great deal. And we will add the disclaimer, we know it's not right for everybody, we know it won't work for everybody, but it has definitely worked for her and keeps her stable. So that's my 2 cents. Thank you, guys.
Thanks, Reed.
Thank you. Thanks, Reed.
We talk a lot, or maybe not enough, about alternative and/or homeopathic complementary care, and to the point you guys are trying to make, it's not a commercial for that, or that's the do-all to end-all, but it's definitely something if you're interested in, you should talk to your care team about, because they will work, you know, with your homeopathic physicians and,
Yeah.
and make sure that, you know, everything's coup de la. Yeah.
Right.
Yeah.
Right. Exactly. Yeah. Yeah. Yeah.
Yeah.
And keeping fit, just really, I recently had to, I broke my foot. I'm out of the boot for anybody that cares.
I
But
care.
they took a,
We care a lot.
okay. They took a blood test before I had surgery on my foot and found out that my vitamin D was like at 9. And under any circumstances, I don't think a single digit of anything is good. It's a good thing to keep yourself on supplements that are taking place of all of the good food you're not eating. I'm sure all of us aren't eating kale 3 times a day and doing all those things. But so there's nothing wrong with staying fit and supplementing, your vitamins and what have you.
Agreed?
Yeah.
Yeah.
Okay. She agrees. That's awesome. It's awesome. It's always a good thing. Ina.
I'm Ina Bauman, and I can't believe how happy I am to be here. It's going to be actually next week. It'll be 4 years that I was diagnosed with, at the time, a very large tumor in my left upper lobe that ended up to be stage 1. It was sort of a crazy thing. I was accidentally diagnosed, so it was a complete quirk. I had no symptoms. And I had a fairly large tumor. It was the size of a small hard-boiled egg. And when they did the first surgery, they could not find any cancer cells. So we were like really, really excited. And I don't know if I ever told this whole story before. I don't think I have because I was conscious at the time. But the tumor was removed, and we were all told that there were no cancer cells. So, and in the before I even had surgery, they could never get any cancer cells in the biopsies or anything. So, but it was such a large tumor, they said it had to come out. So we did that. Then there were no cancer cells. So we were pretty celebratory. I mean, we were actually ecstatic. And I went home from the hospital. Oh, no, I didn't go home. The day I was going home, my surgeon, who I loved, came in and sat down on my bed and took my hand, and then he took my other hand, and then he just looked into my eyes like, wow, and said, I really have some bad news. And the full pathology report showed that the yolk part, as if it was a yolk, was actually a carcinoma. So I went home, healed a little bit, and came back 3 weeks later to have a lobe and a half of my left lung removed to get the clear margins. So I didn't quite get away with the VAT surgery, but I have no complaints. I super agree, by the way, with what you just said about trying to be physically in shape and try to really push yourself. Next to my nurse here, who took care of me and literally made me get up and walk, 3 times a day. Couldn't hardly get to the front door, let alone anywhere else, but we just kept working it up and working it up. And I did not have to have any treatment, so I'm amazingly grateful and just really want to be part of this group. I've come to love so many people in this room and really try to plan our travels around being here as much as we can.
Oh, wow,
I know. I just really want to be here.
Do you get scans?
Yes.
How often?
Yeah. So I just graduated to 9 months.
Okay.
Now,
Okay.
I, like Sally, I have several of the same scar tissue nodules on my right side. But as long as they don't grow, and the oncologist felt like they've been stable, for 4 years. So she just put me on 9 months, and I have full body when I go. But they, and I get, even though I know that they've been okay, the week I go.
Oh, yeah, skin
And
biting.
see exactly.
Yeah.
And the oncologist and, the blood work and everything. So I'm on 9 months. And she told me she'll never make it longer than that.
Yeah.
And,
And
so
that's a good message for any surgical patients in the room and anybody on live that's here. It's surveillance. If you're not getting surveillance after surgery, you should be. Because that's the right thing to do.
And I just want to make one little plug for the fact that I chose, after going for second opinions, I used all local doctors. We live in Los Altos, so used PAMF and in Mountain View, actually, and my surgeon was in Palo Alto. we went to UCSF and we saw everybody at UCSF, not everybody, but a few people at UCSF, and they were great, and I have total confidence in them and think you should go there. But I chose to go to El Camino Hospital in Mountain View for my surgeries. And the care in a small community hospital, and El Camino's not that small anymore, but I just loved it. And I don't think I've ever plugged El Camino, so I just need to do that.
It's
because,
okay. They're one of our centers of excellence. So
yeah, they're just
okay.
super. Right, and you have some of the doctors on the board. Yeah.
Yeah.
So anyway,
Yeah.
that's all. But just want to wish everybody happy holidays and say thank you to this group because you've become a real extension of a family for me.
Thanks.
Yeah.
Okay, can we? Okay, let Steve tell about my necklace.
Hi, I'm Nurse Ratchet. I made her walk every day and breathe into that ridiculous thing. But anyway, it's 4 years. We're going to celebrate 4 years in 2 weeks, I guess. But the necklace, let's talk about the necklace. Really, you have to thank Dave because Dave looked over at me and he said, at the gala, and he said, you didn't get a martini glass. And I said, no, what's that from? And he said, well, there's this raffle, you see, and you pay for the raffle, and then you get your wife this wonderful necklace. And I said, oh yeah, right. So I looked at her and I said, Annie, you want me to get this raffle? She said, how much is it? I said, $100. She said, well, it's for a good cause. Okay, so we did that, and we were walking out of the gala. It was wonderful, by the way. It was terrific, lovely, wonderful people. It was great to meet Dave and really have a chance to talk to him. Besides the fact that he goaded me into doing this very important thing, and we're getting texts from I think Sally was texting me, and Barb texted us, and a bunch of people. You won, come back. We're thinking, oh, they're just kidding it, Of course, we're walking down the hill, right? Yeah, it's a big hill.
It's cold.
Because I was too cheap to pay the price for the valet parking. Cheap place.
That's funny.
Anyway, yeah. So the importance of surveillance cannot be just overblown here. It's so very important. The fact is that Ina's cancer was picked up incidentally. We were going to Vietnam. I'll put in a plug. Go to Vietnam, and before you do, go get a surveillance. But it's a wonderful trip. But they picked it up, but they should have picked it up 6 years before because she was under surveillance for some spots, and the doctor dropped it. And the other point I would want to bring up as a caregiver and Ina's gigolo is that you should really make sure you take your charge of your own body and your own health and your own wellness. Depending on someone else to read the record and say it's time for another scan, it's like that ain't gonna happen in a lot of cases, and we all pay the consequences. So that's a big learning for us.
Thanks, Steve. I actually have a question. So 6 years prior, they saw something, and no one called you to come back or told you to come back?
Actually, it had been a lot longer than that. I had a very strange case of mycoplasmosis pneumonia, which goes, it's a weird bacterial/viral infection. And at the time, it kind of manifests like mono. It was sort of like I was exhausted. And the internist that we used at the time actually pursued it continually to get a diagnosis and treated me with, large masses of antibiotics. It took about 4 or 5 months to clear up, and it laid down all the scar tissue in my lung. He took x-rays every year for about 6 or 7 years and then just stopped. And I remember the first year or two thinking, oh, I should have probably asked for an x-ray, but he did it all these other years and he stopped doing it, so maybe I don't have to. And then I just stopped, kind of forgot about it after a couple of years. And he never did it. He never asked for it again. And then we switched over to PAMF and had a wonderful new internist. And nobody does chest x-rays. I mean, that wouldn't be something. And I had kind of forgotten about it, actually. And in the meantime, it grew rather large. The scar tissue was very large and, formed a cancer inside.
Yeah, scar tissue doesn't grow.
Scar tissue carcinoma.
Right.
Yeah, very rare, very unusual.
Yeah.
And that's
Yeah.
why we have to watch the other
Yeah.
side, because
Yeah.
they're all there.
Yeah.
Yeah.
Interesting.
Yeah.
Thanks, Anna.
Good information for everybody.
But you're going to have to take the necklace off next scan. What is that? What is that? Oh, that's my necklace. My name is Betty Corner, and I was diagnosed in 2014, in September 2014, with adenocarcinoma, EGFR positive, exon 21. And it was an unusual finding. I coughed up a little tiny piece of blood. And I say piece because it didn't feel like a bloody sinus or something. It just felt like this little bitty clot, and it seemed strange. And I almost didn't do anything about it. And I thought, well, all right. I called my advice nurse, and they said, oh, how about you come in tomorrow morning at 9 o'clock? And so I went in tomorrow morning at 9 o'clock. And my doctor was like, oh. And then she just was on the phone to her friend who was at the hospital. And I went in, a pulmonologist. And I had more tests in that 1 week. I've heard many stories of people not getting much attention, but boy, tell them you coughed up blood and you'll have their instant attention, because I had a TB test, I had an extra mammogram, I had a lot of tests before they finally, they had a CT scan and they found a 2x4 centimeter tumor in my right lower lobe. And it just seemed so weird to me. I'm a never smoker, and I was in pretty good health, and I hadn't really had any symptoms, so that seemed very strange to me. It seemed strange to them, but there it was. So I had a needle biopsy, and they called me. I was teaching violin, and I'm still teaching, and the doctor's telling me, you have adenocarcinoma. It's like, oh, I can't talk right now. And I just kind of hung up and thought, what the heck, what's this? So I went to a tumor clinic, and they figured it was probably stage 1. It looked like they felt very encouraged that they just saw the one thing and that I didn't have any other symptoms. However, I went in for my pre-surgery checkup, and after careful study of my brain MRI, they did find brain metastasis. I was not aware of just what a change in my diagnosis that was. And I was escorted down the hall to treat my symptoms systemically as opposed to surgically. So I met my oncologist, and let me think. There's a series of things you do. One, I had a cyber knife to remove the 2 metastases. And even 4 years ago, it wasn't as common to have the molecular testing. I think it's more common now. But they had that. They didn't check it until I was marked stage 4. And I had 1 round of regular chemo, permextrid, and carboplatin. And then it was found out that I had the EGFR positive, so I was put on Tarceva. Let me see, that was all middle of September 2014. Middle of December, it looked like things were doing well. It looked like my tumor had reduced. And because of patients and doctors getting together, they had changed the NCI guidelines almost exactly when I needed them to, and I'm very grateful for the people that did that. And what my kind of cancer is called is oligometastatic, which
You can
means...
thank my daughter for that. She was one of them.
Not just me.
Thank you.
But she was one
You're
of them.
welcome.
I was totally clueless this whole time. You're just kind of flying down a freeway trying to figure it all out as you go.
Yeah.
And I was trying to convince my surgeon, and my oncologist was trying to convince my surgeon. The NCI eye guidelines changed, and my surgeon emailed me that morning at 5 a.m. saying, okay, let's schedule a date. So in January, I had my back all opened up, open surgery. He removed my right lower lobe. I just lay there. I was
I was going to say, that's awesome.
and they found nothing. They checked 19 lymph nodes and a small wedge in my right upper lobe, and everything seemed clear except for the tumor itself. Again, I really believe staying healthy, regardless of the cancer, helps you do your best for the treatments, because the treatments can be harsh. I was told how harsh the surgery I was going to have was, but I'd started doing this Bikram yoga, and I am a Bikram yoga fan, and I do the breathing exercises. I still go. I was there this morning, and I think it helped me be healthier. It certainly helped me not be so stressed out, because I didn't have to drink or take a pill or do anything to go to sleep at night, and because I was so tired from going to Bikram yoga. But it helped me stay healthy, and I had a year and a half later, they thought perhaps something was growing in my brain, and I had them actually go in and check, which was sort of exciting. But it turns out that it was just necrosis, which happens sometimes with radiation and cyberknife. So I've been NED, and it's interesting. We hear the different doctors. I have a regular doctor. I have a pulmonologist. I have my surgeon. I don't see my surgeon anymore. I have my neuroradiologist, and they all have a different personality. So it's always interesting to interface with each of them. I just had my MRI maybe a week ago. Still good. Everything's good, and I'm coming up on 4 years, so I'm very grateful. Thank you.
Thanks, Betty. I think that's really helpful and encouraging information, particularly when you're talking about the oligometastatic disease and the treatment of the brain metastases, because I think that's the brain metastases is a fear for a lot of patients, right? And what the treatment looks like after that. And then the oligometastatic disease, we can't talk about enough because there's so little information out there, particularly in the community setting, about how to look for it, what it really means, and then how to treat it once it's clearly defined. So thank you for sharing.
That was the first time, though, that disease had, the NCCN guidelines were changed by patients.
Yeah, patients did lead that. Thank you for the plug. But but that was an army of patients, and I signed on to kind of march with them as the patient advocate. Yeah.
My doctor told me that she's the only I'm the only person she has seen with both the nature of my illness and the successful recovery so far.
Yeah.
So I'm grateful for that.
Right. It points back, I mean, everything we're talking about today and everybody that's telling their story, I mean, it's the definition of personalized medicine, right? I mean, everybody's, thus far, their treatments have been very personalized to them and what their disease looks like.
There's precision medicine, and then there's personalized medicine, and I happen to believe that the precision part of it is diagnostic testing and, doing all the things you can do to, make the correct diagnosis and things like that. But then it becomes very personal. Who is the patient? What else is going on with them? What other diseases do they have? And so on and so forth. So you can get absolutely the right treatment for the right patient.
Thanks.
Quick question.
Uh-oh.
Still on Tarceva?
Yes, I am.
So you've been on Tarceva the whole 4 years?
150 milligrams.
150 milligrams. And no horrible side effects?
Well,
Or is that a
no
touchy
horrible
question?
side effects. I've read the whole little paper that comes in the box,
Yeah.
and after reading that, I have to say no horrible side effects. They do have horrible side effects. We have, a little bit of acne and occasional diarrhea or some stuff in your hair, just a little bit. Not bad.
No. Okay, thank you.
Hi, Sally.
Hi. When you were saying how many, not episodes, but meetings we've had, I'm the senior member,
Yep.
both figuratively and I'm the eldest here, and I've also been here since day
That's
one.
it. That's it. That's
Yeah,
fantastic.
I am the oldest. I'm
We need to
pretty
get
sure
you
of it.
some sort of pin or something.
Yeah, I'm going to get a pin.
Yeah,
say,
we'll
I'm
get
old.
it for you. No. Talking about 157 meetings.
I don't think you're the oldest.
You get chips for that in AA, don't you? You get something. Yeah.
Yes.
Yeah.
Anyway, I'm Sally.
Why were you looking at
and-
me?
Oh, I don't know. Sorry, Sally.
And I was at very high risk. I'd been a smoker, but I had quit 20-some odd years before. Well, when I got diagnosed. Before it was 15 years, I found out about the International Early Lung Cancer Assessment Program. For people at high risk, you had to be a 30-pack a day smoker for 15 years. And I think it was 15.
Not
And-
30 packs a day.
Or 30 packs?
1 pack a day for 30 years.
I'm saying it all wrong.
That's
I'm
okay.
sorry.
I was like,
I'll
wow.
need some more
today.
wine.
I know, I had time to do anything
anything
else. Yeah. Smoke 1 pack at a time.
A 30-pack a year smoker.
1 pack a day for 30 years.
Right.
They say it all backwards. I get it. Yeah.
I'm sorry, I got that all screwed
Yeah,
up.
that's okay.
That's my age. But anyway, I found out about that, and I thought, my mother had lung cancer. She'd had it 3 times and lived 22 years from beginning to end. And her brother had it, and my paternal grandfather had it. So I thought, maybe I should check this out. So I asked to be a part of the study, and I qualified. I just got in under the, you couldn't have not smoked for more than 15 years. So I got in just under the line. And they told me I had nodules in all my lobes and that they weren't concerned about them. Now, of course, I panicked the first time I heard that. And I checked that out with my internist and a couple of other people. And they said, we're just going to watch you, and you'll come back for these low-dose CAT scans. It was to see if the low-dose CAT scan could discover lung cancer before an X-ray. And I knew from my mother that when hers was discovered, she'd had an X-ray 6 months before and it was fine, and then thought she'd broken a rib 6 months later and found out she had lung cancer. So I knew that they used to say by the time it showed up on an X-ray, it was too late. Well, she disproved that. Anyway, so I entered this study, and after about 5 years, I went for my scan, wasn't at all worried, things are going to stay the same. And I get a phone call the next day that they felt they knew one of them had grown. It wasn't big, but it had grown, and it had grown enough that they felt it was lung cancer. And they'd spoken to my internist already, and he wanted me, I was at PAMF at the time, he wanted me to have everything done there. And I was very lucky. I had my lower right lobe removed. None of my, lymph nodes showed anything. But if I had to do it again, I'm listening to some of this tonight. I thought I knew everything there was about lung cancer because I'd gone through it with, well, not my grandfather because I was too young, but with my mother and my uncle. And when they were diagnosed, they didn't do biopsies and things like that. So first, the surgeon told me, well, we're not going to bother to biopsy. We just know that it's going to be cancerous. And it's small, and you don't need to worry about it. So I didn't question it. And then he sent me the pulmonologist, and she said the same thing. Oh, we don't have to biopsy it. Well, today I wouldn't have stood for that. But at that time, I didn't know any better. And I was kind of cocky, thinking I knew everything. And then after the surgery, all I kept being told was, you're lucky, go home and forget about it.
Way to get to thank her.
And, well, how do you go home and forget about it? Yes, I was lucky. I knew my mother's had come back 2 more times. And I wasn't very happy about it. So I did when I saw the surgeon, he said, go home and forget about it. And I said, no, I want to see an oncologist. So he had me go see the one at Pam, who I'm sure is very good. But meanwhile, someone said, go get another opinion at UCSF. And so I did some research and found Dr. Jahan, and I went up there. And I had gone into the pulmonologist and the surgeon after surgery with a list of questions. I'd been reading stuff online afterwards. What is the prognosis? What are my chances of it coming back? All I kept getting told was forget about it. Just go home and live your life. When I went up to UCSF for a second opinion, I went up with the same paper, and boom, 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 he didn't even look at it. He said, you've got to be watched the rest of your life. You have nodules in all the other lobes. You have a family history of this. And he went on, and he said, now, do you have questions? And I said, you answered every single question on this paper without me asking. And I fell in love with him. I call him my boyfriend. And he's a teddy bear. You want to take him and hug him. Anyway, so he's been watching me, and I got scans for the first few years. I got scans every few months. And then he had told me if it's going to come back, it's probably going to come back in the first 2 to 3 years. And my mother's second one came back 2.5 years later. So he said, after 2 years, you can go home and have a glass of beer to celebrate. After 5 years, you can go home and have a glass of wine. And after 10 years, you can go home and have some champagne. And I'm coming up on that 10 years. But anyway, ask questions. I didn't get any molecular testing. They weren't doing it in a community hospital at that time. When I did ask for it and made an issue about it, it was 5 years out. And my oncologist said to me, Sally, if you get a new one, we will definitely do it. But he said, the likelihood of it being the same thing that you had is very, very little. So we would biopsy anything new. Now he tells me that he feels all the nodules and ground glass that I have in the other lobes, that he doesn't feel if it comes back that it's going to be one of those. He feels it will be a totally new primary. And knock on wood, it hasn't.
Thanks, Sally.
My whole life story.
Rick, you're up.
Hi, I'm Rick. I was diagnosed in February of 2015 with stage 4 adenocarcinoma, and I've been treated at Kaiser in Santa Clara. I was working at the time and tried to work through my treatments on my 3-week cycle. That lasted 5 months, and then I went on disability. I was on carboplatin and Alimta for 4 cycles, and then Alimta only for a total of 7 months, and then that the tumor I had on my adrenal gland started progressing, and so since the carboplatin had taken care of my lymph nodes and the tumor in my lung, I became a surgery candidate, and they were able to remove a fist-sized tumor out of my laparoscopically, and
Wow.
with that, and having come to the living rooms, I pushed for getting the Foundation Medicine genomic testing, and it came back and it confirmed what my Kaiser doctors had said, that I didn't have any of the mutations. I didn't have EGFR, ROS, ALK, didn't have any of it. So I stayed on the Alimta for one more cycle, and then I moved over to Taxotere till I ended up having 12 full months of chemo. And in February of 2016, my PET scan was totally clear and has been ever since. So I've been NED for a little over 2.5 years now. And my doctors really scared the bejesus out of me when they gave me the prognosis and gave me the 9 to 12 months of, life expectancy. So don't believe in the statistics. It gave me pause, and it got me really going on putting all the affairs in order and having, everything taken care of so that my wife and family will, won't have to deal with as much. But right now, it's like I retired from work. I never went back to work. And it's been a real blessing. It's allowed me to do a lot of the things that I couldn't do when I was working 50, 60 hours a week. Was able to, last month, my wife and I, we celebrated our 35th wedding anniversary, and we went on a cruise
Nice.
through the Panama Canal and up the Costa Rica coast, and it was just wonderful. And I'm just very thankful to have support groups and being taught how to really be an advocate for yourself and push for your own care. So I guess the other thing that I did was I shared it, my diagnosis, with friends and coworkers and people from church. And so I had, a pretty large community pulling and praying for me that really, I believe, helped a lot. So, Merry Christmas.
Thank you.
Thanks, Rick. I have a quick question. Was anybody else given sort of that lifespan at diagnosis? I know it happens all the time. We talk to patients all the time, and I don't know if anybody else in the room had experienced that. Just right? Yeah, you did. No. Yes.
Yeah.
So there's sort of varying answers in the room, and
A statistic saying you have 12 months to live.
it
or
happens
6
more
months to live.
often than it doesn't, and it's based on statistics and data, typically old data or dated data, and it's not really looking at the individual, right? And when they're giving you those sort of timelines, if you will, they're looking at median numbers, not really numbers under or numbers above. And it's always so frustrating to me, especially today, right, in a day of precision and personalized medicine where no two cancers are alike, for anyone that, other than whatever sort of higher power you may or may not believe in. It makes no sense to me. It infuriates me. Because what it does is it immediately removes hope from the thought process and the conversation of the person that these people are talking to. So thank you for bringing it up and saying don't listen, because no one in this room, no one online, no one yet to be diagnosed is a statistic.
And sometimes patients gravitate toward other patients that are just like them. Well, there are no two patients that are alike. You just look at all the different stories you've seen here tonight and will continue to hear. There's no two alike. And then you have other things going on with your body and other diseases possibly and what have you. It's great for patients to chat with each other and do all of these things, but you're all really very unique.
Yeah, and I just encourage anyone who is being treated by someone who they feel is treating them as though they are a statistic to get a second opinion.
You're not a statistic.
Yeah. Parenters.
Merry Christmas.
Oh, somebody. Oh, hi, Ron.
Ho, ho, ho.
I can't see far away with my reading glasses on. Sorry.
So, speaking to the statistics are based on 5-year numbers. So 5 years ago, that's how old the statistics are. They're based on a 5-year survival status. So 5 years ago, did they have Tarceva? They were just starting. So there's the results of all the targeted therapies are just starting to come true. And so you can't believe the statistics because they're old, and you are a statistic of one, a database of one because you're unique. So remember that. And the other things to remember is that the American statistics are based on statistics that come out of the national government in the U.S. It's called a SEER database.
Yep.
But the database that's internationally is a different database, and they have slightly different numbers because they have different populations, and so they're more or less close. So you just have to be careful of statistics because, you know, people can figure out numbers, but numbers can figure out something else.
Exactly.
That's true.
I want to say ho, 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 because
Merry Christmas?
because I can't stay.
Oh, did you bring cake?
I did not bring cake. You're going to have to wait till next year.
Just stopping by. No cake.
You know, I have a meeting I have to head to, so
Have
Merry
a Merry
Christmas,
Mary.
guys.
Thank you for saying
Okay.
hello. Thanks, Ron.
We'll forgive you, Ron.
Okay, we're ready.
Okay.
Are we here?
Yeah.
Yes.
I'll see if I can get this straight with all these very detailed stories. I'm Joanne Berridge. I was diagnosed in September 2016, and that was after a year of seeing my internist with a cough and being sent to the ear, nose, and throat people and to the allergy people, and full circle back again to her, who finally did a chest x-ray. And someone over here talking about you were playing the violin. When she called me about the chest x-ray, I was in Chico's trying on an outfit. I'll never forget it. And that, of course, entirely changed what I was thinking, what I was doing, because of the first hysteria. That there was a mass in the middle lobe of my right lung, and that I should immediately see. I guess she sent me first to a pulmonologist. It was to a pulmonologist that I went first, a really wonderful woman who immediately set me up for a CAT scan, and she set me up for a biopsy at the same time, so everything could happen simultaneously. And then I think she actually even set a PET scan for after the, anyway, she saw me on the spur of the moment before hours of a morning.
When was this?
September 2016.
16.
Yeah. Anyway, before her hospital round, she came in and saw me because my daughter was on the phone saying, we can't wait 2 weeks for this. It's got to be now. This is urgent. So her name is escaping me right this minute, but she was wonderful. Had the biopsy, or had the scan, and it showed the, no, I guess first I had the biopsy. I'm getting the order of this wrong. Anyway, the biopsy was with Dr. Krishna, whom we've talked about a lot down at El Camino Hospital. And Ina said she's the one who taught him to be positive and hopeful and nice, because he was wonderful with me. And she says he wasn't always that way, that he had to learn that.
But he was very receptive.
Okay. So anyway, the pathology then did show that it was adenocarcinoma, non-small cell lung cancer, but of course the details of what mutation it might or might not be had to wait for the full lab report. Meanwhile, had the CT scan, and it did show a 5 centimeter plus mass in my middle right lobe, and a smaller one, I don't remember how it was, but it was on the adrenal gland, and numerous bone metastases. Also, they did an MRI, and there was nothing going on in the brain. Then a PET scan showed the strength of the metabolic activity in all of this, and soon the results came that it was an EGFR mutation. I remember By this time, I had been introduced to Adario by my sorority sister, Jackie McNamara, who now lives in Carmel, and so she doesn't come up for the meetings. But hi, Jackie. I'm sure
She's
you're
watching, yeah.
And I always like to give Jackie credit for hooking me up here. And I remember having talked to Danielle after the first diagnosis, and then I remember calling you with this great news that I had this mutation that there was a targeted therapy for. I still remember that, and you agreed that that was wonderful, and you also pushed for a second opinion. And by this time, I did have an oncologist at PAMF, and acknowledged the mutation and had put me on the 150 milligrams of Tarceva. And meanwhile, Danielle was getting me an appointment for a second opinion, and it happened that it kind of came two at once. One possibility was UCSF, and one possibility was UC Davis. I took the UCSF because it was a couple of weeks sooner than the Davis, and this was all still in the real panic mode time.
I think we'd started that process before we knew what your genomic profile was.
I think we probably did.
Yeah.
Yeah, I'm sure we did.
Yeah.
Because with the panic, it was about 2 weeks before we knew the
Yeah.
genomic process.
Yeah.
So anyway, the UCSF appointment turned out not to be with Dr. Jahan, but with one of his colleagues, Dr. Blakely, who was here a few months ago giving the presentation. And I have since learned, and I didn't know this until maybe till he was here, that EGFR is the subject of his research. And in fact, an article just came out recently that they've made a breakthrough in a combination therapy for what happens after the T790 mutation. And that's all very exciting. And anyway, that's an aside.
He's doing a lot of work in the resistance area.
Dr.
Yeah.
Blakely. It's the resistance, it's resistance that his research is. So I was on Tarceva for 2 years, and I did have some side effects. At first, I had nothing. And in fact, Dr. Blakely said, wow, you're lucky, no rash, no nothing. Well, that changed sometime in the second year, and the last, I'm going to say 6 months, I started developing scabs on my head, which I hadn't really heard of happening to many people, but I guess it does. I'm not totally unique in that, but a little bit of an outlier in that. And that actually, as the scabs came off, the hair came with it, and so this is my lovely wig. The dermatologist did not think that I would regain hair. She thought that all of the hair follicles were dead. I am regaining hair. It's not ready for prime time, but maybe by June I will no longer have the wig. So that's the good news ending to that. And toward the end of the Tarceva, my oncologist, and Blakely agreed, had reduced the dosage to 100 to see if that would stop the scabbing thing. We don't know if it did or it didn't, because when I had a scan 2 months, I'll say 2 months after the dosage reduction, it did show maybe some new little spots, okay? So, and this was just about at the 2-year mark of the Tarceva. So because it showed some little spots, my oncologist ordered a PET scan. The PET scan showed that the spots were nothing, but that there was increased metabolic activity in the original tumor. So Dr. Blakely immediately ordered a garden test, which did show the very beginnings of a T790M progression. So I was immediately put on Tagrisso, which I might have been anyway, because in the meantime there, Tagrisso had been approved as first line and preferable to Tarceva because it breaks the blood-brain barrier. Although as long as Tarceva, and I think Dave will talk to this too, is being effective, they hesitate to change you to the Tagrisso. Well, given the little progression, I went on the Tagrisso. I have been on it for almost 4 months now. side effects almost nil. And I have had one scan at the 2 months mark, and that showed everything stable and the lung tumor perhaps even further reduced. And what I didn't say in the beginning is after the first 2 months of Tarceva, the lung mass had decreased to 2 centimeters from 5. So it was really a dramatic change. And all the bone metastases were gone, except that there is some funny tissue left that doesn't look like real bone, so it still shows up in the scans as something weird. But in the PET scans, there's no metabolic activity, so the blood or the bone metastases are gone, and there's still a tiny bit on the adrenal gland. So that's where I am. One other thing I would like to point out is I have been part of a research study at Natera on to determine lung cancer progression based on the level of circulating tumor DNA in your blood, and at the same time that the Garden test came back with the T790M, the latest blood draw at Natera had also shown an increase in my circulating tumor DNA. So everything coincided, and one thing kind of supported the other, and it's nice to know that the Natera study is showing results, and even though it doesn't identify what the increase is, the Garden test did that. And you didn't ask us this year, Danielle, what we hope for next year, but I'm going to say this, I'm going to introduce that topic and say the same thing that Dave said last year, and that's I want to be sitting right here with all of you next year.
Oh, there you go. Okay. Okay.
Thanks, Joanne. You don't want to talk about your work and
All right.
I don't have a lot to add. I'm Sarah. I'm Joanne's daughter. The one thing that just sticks out, and this has been, I'm just kind of echoing what other people have said, is to keep a positive attitude, to keep that hope. The whole mortality rate thing makes me irate too, because you're right, it just takes hope and throws it out the window when you don't even know necessarily what you're dealing with yet. So to maintain a positive attitude, to stay active. My mom runs circles around me. I mean, I'm busy. I have a full-time job. I have 2 little kids, and I'm exhausted. And she's like, well, I just came over and I made you this chocolate cake, and I brought this, and here, this is for the kids. And then I ironed your shirt, and I ironed the brownie badges on, and I'm like, well, you did what? I'm like, I mean, and I think that it's really, really important to continue your life. And so that's thing one. Thing two is, pushing for yourself and advocating for yourself. I mean, there were times, as positive and hopeful as my mom has been through this whole journey or whatever we're calling it, there were times when she was down and I could tell that she's just like, oh, forget it. I can't call them again and harass them. And I'm like, okay, I'll call them. I'll harass them, whether it's to get the test results or to get the next appointment, or, I mean, like you said, the scanxiety is unbelievable. And I think just, staying on top of that and staying on top of your doctors and pushing and pushing and pushing has helped us tremendously. So as irritating as I probably am to most of these office staff people, we get answers and we keep moving because, one thing just to kind of wrap it up that Dr. Blakely told us really early on was you got to stay ahead of this. And if you stay ahead of it, you're going to have better results and you're going to live longer and you just feel more in control.
Absolutely.
So thank you guys for everything. I mean, like my mom said, we want to be here next year with all of you. It's been an incredible help for me and for my mom and for our whole family and Nurse Ratchet.
Right. Okay.
Okay, I'm Barb, and I'm actually Dave's wife, so I'm going to talk for Dave. Try and get through this. We actually got some tough news last night, so we're looking for that. So Dave was diagnosed in March of 2017 with stage 4 EGFR adenocarcinoma with brain mets and lymph node activity. So he was put on Tarceva. He had SRS to the brain, to 6 lesions in the brain, and that actually went really well. He had a minor setback with some seizure activity later on that, but he's on a drug to control that, so that's been good. He had some pretty bad rash early on, so they cut his dosage from 150 to 125, and he'd been on that. And then about, I think, I can't even remember when it was, but about a year after on the Tarceva, they started to see some growth in a lymph node in his chest. And so kind of the oligometastases, they decided, well, that's the only place that's growing, so they decided to do SRS to that lymph node, the hilar lymph node in his chest. So we had that in September, and at that time he went off the Tarceva for a couple of weeks so that he could have that radiation. And then at that time, they felt like everything else looked good. He had a PET scan, nothing else was growing, nothing else was showing. And then, so that was just September. And then he went back on the Tarceva. When he went back on the Tarceva, he had a very, very bad reaction. The rash got so bad, he actually developed a staph infection on his face and had to be taken off the Tarceva, go on an antibiotic. That's kind of been cleared up. Had a scan last Friday, and last night we got word that there's extensive growth in the lymph nodes. So not the one that was radiated, that's looking good,
Okay.
but a number of others.
Okay.
And he's also, when he was originally diagnosed, he had significant pleural effusion, which they actually extracted about 750 milliliters of fluid out of his lungs. And that has returned. So he has the pleural effusion again. We see his oncologist tomorrow morning.
Okay.
So we don't know what the deal is, but that's where we are.
Thank you.
No. So call us after your appointment tomorrow.
Will
Call
do.
us before your appointment tomorrow, more importantly, so we can have a conversation about some questions to ask. This is not the end of the road. It's not news you wanted to hear, but there's things that can be done for sure. So
Everyone's stories here are what keep us going, because we're like, well, we've heard people that have had this kind of shit happen, right? I know you're not supposed to say that on TV, but that's what it is, right? Okay. So, and everybody doesn't have the smooth road where they're on the same drug for 10 years and it works. It's like a lot of people, I mean, I look at Don's stories, right? He's not here tonight, but he's had like 6 different things, and a lot of people have had a lot of different things. So we're hoping that she'll have some options for us. We've also seen Dr. Blakely as a second opinion. So we just went and got copies of our scans today so that we've got
Dr.
them for him.
Wakely or Blakely?
Blakely.
Okay.
Blakely.
Okay, good.
So we know that there's resources.
Yeah, and we're going to have big conversations about it.
Yeah, and we're like, well, the living room always comes along right when we need it. You guys are always ready.
Yeah. I mean, and I don't have a lot of information. Obviously, we're not physicians, but depending upon what really we're talking about as far as progression in the nodes, I don't know if you're talking about mediastinal nodes, if they're hilar nodes, if they're where up on the chain they are, even the effusion, how big, bad, and ugly that may or may not look on scans. But I can definitely help you with the questions to ask your physicians regarding options based on what that looks like. And we've heard people in the room over and over and over all these years, even if your next best option is some sort of chemotherapy to systemically treat what's going on and knock it back, that's not a bad option. Chemotherapy is not a bad option. It's particularly scary for people who have been on targeted therapy and that's all they really know, because there's a newness to it. But I mean, you heard Jane talk about it, and we heard Betty talk about it, and and Joanne. And I mean, it's not. It's a scary thing because it's an unknown, but there's definitely moving forward from this, and we're here, all of us. Betty.
I'm just wondering, can they do genomic testing on a pleural effusion?
Yep.
Yeah, that's actually originally how they found the EGFR, was with his original pleural effusion. They did that and found it. And when they did did a biopsy of the hilar lymph node that they radiated, that actually didn't show any changes, and there was no T790 mutation. So, he's not. Interestingly enough, although Tagrisso has been approved as a as first line for EGFR
Right.
or second line for EGFR with a T790 mutation. It has not been approved as second line for EGFR. So if he doesn't have the mutation, it's not been approved. And our oncologist has actually talked with Dr. Blakely about that because they can sometimes get around it by saying the patient couldn't tolerate the Tarceva, which based on Dave's staph infection, I have pictures to prove that he could not tolerate that. So we've got that base covered, but we were not sure what they're going to be recommending tomorrow.
Yeah. Okay.
So I've had the rash. Those
Forever.
of you who know me,
Forever.
yeah. I mean, this is wonderful.
Yes,
This
mild.
is not. This is nothing compared to what it was a couple weeks ago. It was nasty. But I, between an antibiotic and a steroid cream, it was within 2 days I started to see some relief, and this is 6-7 days later. And so it's kind of back, I would call it back to my normal state of redness.
Okay.
Slight breakouts, but, much, much better. So I feel good about that because that was really debilitating for a bit there. One thing that happened that I want to share was I didn't get I had a scan a week ago, and we're going to see the doc tomorrow, the oncologist. The scan was Friday. And usually my primary oncologist, she releases the information and sends me a message right away within 1 to 2 days max. Within hours, yeah. Usually the next day or that afternoon, that evening. And she always says, here's what we saw. Now, thankfully, it's always been good, and so that's an easy email to write. But this one, we didn't hear from her. So I had, hello, where are you?
Right.
So I emailed her and said, by the way, the rash, because I had told her the rash was breaking out pretty severely. And so she sent me immediately, she got me into a derm because my derm wasn't available that afternoon. So we got a jump on the derm situation. But she came back to me and gave me the whole list of things that were going on without going into too much detail, because most of that are words you don't know, and you have to start looking things up.
Right.
So these were all new words to us, many of them, and we'll find out tomorrow. But it's interesting, you kind of get a pattern from your oncologist. Maybe the rest of you see this. When there's good news, they're readily available to talk about it, and when it's not so good news, if they're going to see you in a few days, I think they'd rather see you to discuss it than anything else. So I don't know if that's her style or if that just happened to be the situation or if she's actually doing some more research on what it is she wants to do to treat me next, talking maybe Blakely or talking to her radiation oncologist or, other pros.
Probably a combination.
It's a combination, yeah.
Yeah.
But, when you're sitting around waiting, and there's been a pattern for almost 2 years now of hearing from her right away, all of a sudden you don't, and, so you start to get a little crazy.
Well, I can tell you that more often than not, I mean, you've been getting great response,
Right.
It's not always like that. It's not always like.
No, it gives you a false
whether it's
positive.
good news or bad news, they just don't, they just don't respond as quickly as they should, regardless of
Right.
what, so.
Yeah.
Yeah.
So, last night
Okay.
was a tough one for both of
Okay.
us. But we kind of woke up today and said, let's
Okay.
strap it on and get going.
Okay, we're going to
So-
make you a list of questions.
Okay.
Yeah,
For sure.
let's
Absolutely.
talk about it after. And
Yeah.
we'll
Already
figure out
going.
how to
Thanks.
do
Yeah.
it. Yep.
Blah, blah, blah.
Be great.
Yep.
Thanks, you guys.
Oh, by the way,
I knew
By
it.
the way,
I knew
I
it.
have the goodie bag with all
boy.
kinds of things in here that I
boy.
can share later on.
okay.
Things for rash, things for dry mouth,
Right,
all
right,
kinds.
right.
Live Strong,
Right.
Live Well from Stanford. I got
Right.
all kinds of stuff over here. So if you want to come see Santa Claus later, okay, it's right here in the bag.
Thanks, Dave.
And
I
this
don't
is what a
know.
support group is all about.
You want to drop the mic over on this side? Yes, we'll go up this way and around. Drop the mic. It's not how I meant it at all.
You want him to throw it on the floor, right?
Thank you. My name's Marie. I'm sorry about the scans, and I thought it was really lovely how you comforted your wife while she was talking. I was just recently diagnosed in September, I believe this started. They were treating me like I think other people with thinking it was asthma, then allergies, went to urgent care and said, I think I need a chest x-ray because someone at my office said I needed one, got one, and then whoosh, it just happened so quickly. So saw the pulmonologist and then she got me into the oncologist, did the genetic testing. That was a little painful waiting for that. But I have non-small cell lung cancer stage 4. And I didn't get any great hits with the genetic mutations. So EGRF negative, ROS1, I think negative, ALK negative, PD-L1 positive low. But my manager at Pharma had seen an article recently where Keytruda immunotherapy was given to people who were PD-L1 positive low, went to my oncologist at PANTH, and she was so receptive to it because it had just come out and FDA approval. Got that added within 2 days prior to my first chemo, which is carboplatin, Alitma, and Keytruda. And I have 4 cycles every 21 days. I just finished my 4th cycle. I have had no problems. I think I'm really lucky. I'm working full time, not at great capacity and not especially productive, but my team has been great. And no nausea, no constipation. I just think I'm pretty darn lucky, and I think carboplatin for some people isn't so bad, and it's been the case for me. I traveled the day after chemo. I'm going to be traveling again to visit some friends, and I will be going on every 21 days Alitma and Keytruda, which I think is going to be a piece of cake. So. So far, it hasn't been bad. I'm just waiting. My expectation is always, I like the glass half empty. So I did the research, and I'm like, okay, 50% make it to, 2 years, 50% make it up to the 5. Okay, I can live with that. Got my will, my trust, everything in order, and that gives me comfort because that's where I have control. And then I just go about living and trying to beat the expectation. And I don't look at it as a battle I'm going to win or lose. I look to say, hey, what's medicine offering now? There's a new drug that just came out this November 26th by Loxo.
For NTRK.
Yes. Fascinating.
So this is what I want to ask you.
Yes.
You got genomic profiling
I
or
did.
next-gen sequencing. How many markers did they test you for? Because if NTRK wasn't on there, because it's only been approved in the last few weeks.
It wasn't on there.
Was MET on there, or?
I don't think
No.
so. I think I've got a PDX, so I'm getting individualized treatment where they're growing my tumor in a poor little mouse.
Okay.
And it's been, they're waiting to see if it's going to take. It doesn't always take. So they're doing, my company is doing that as a personalized medicine to see all the treatments they can do on these little.
But in order to do that with the mice, they need to know what all of your markers are, because they're going to use different drugs on those mice.
So I'm guessing, so what she's getting at is, was it like a baseline lung panel that you had, EGFR, ALK, ROS1,
Just
or
3
did they do a
markers.
comprehensive
I think
genomic?
from what you're saying, I think mine was the basic
Yeah, that's
lung,
what it
and it
sounds
doesn't mean, and I think it was done by Foundation
But
Medicine.
they added, if it was Foundation Medicine, then you had next generation sequencing / comprehensive.
Which
The
NTRK
ones that
would have
they
been in there.
discussed with me are those. And so I did bring up, I had a chest x-ray on the 3rd, and I saw no change. There was no change in my tumor. I'm like, okay, I'm prepared. That's all right. I'm prepared. So I don't get disappointed. And then I had my CT scan, and it turns out that the tumor did not reduce that much, but my oncologist at PANTH and my interventional radiologist were thrilled because my coughing has subsided substantially. All the gauze or that broken glass kind of
Ground glass.
ground glass all over my right lung has cleared up, and the lymph node in my neck where they did the biopsy, the interventional radiologist couldn't even see where it was spotted. So it's still in the adrenal gland. He said it looked better. So I've got 2 of them that I'm really close to, my oncologist and interventional radiologist, and I got great information from them. So I did ask about the new genetic marker that they found on there. And my oncologist said, look, you're doing great. there's going to be a point you're not doing great. At that point, we'll look and see what the other options are. And that new drug, they're going to have more information on it. It's not really profound for what I have, but in 2 years they might be doing studies so that it'll be approved by insurance. Insurance is a pain in the ass, as we all know. So even with the study that showed that Keytruda was beneficial, that the FDA approved it, the insurance denied it. And so I hear this is kind of standard. So my doctor and everybody at PAMF said, don't fuss. It will all be taken care of. But it's really a shock when you're expecting and say, please do, I don't want any treatment that's not going to be covered by insurance. And then at your third cycle, you get a bill showing how much Keytruda is, which is about $30,000, and your portion is only going to be $14,000. And so I was almost ready to just say, I don't know how much is benefiting me, but it will go through my inheritance of what I'm leaving people. So you start to make decisions of how you want to proceed with treatment. But I understand that this is kind of standard, and I have people working on it. But I feel great. I love that I'm not coughing as much, and I'm looking forward to going on my other treatments. So I hope
That's great. Thanks, Marie.
Marie, who's your oncologist at PAMF?
Kalochi.
Kalo. Yeah, okay. And your radiation oncologist?
Tamrazi. Excellent. Annabelle.
Thanks.
He's over at Sequoia.
Oh, did he replace Lisa Buhar? He must have.
Pardon?
At Sequoia.
At Sequoia Interventional Radiologist Annabelle Tamrazi. 40 minutes.
Oh, okay.
Hi, I'm Lori. I was just diagnosed this year with stage 4 lung cancer. And when I was diagnosed, I had brain surgery. They told me I had asthma for 4.5 years. I had a 6-centimeter lung tumor that didn't show up in an x-ray. So by the time it had metastasized everywhere, brain, bones, all my vertebrae, liver, kidneys, lymph nodes, everywhere. And the doctor, I went and got 7 opinions, but the first doctor had a lab, and they took it as a live tissue sample, the tumor, and by doing so, they are able to test it against all the drugs as your tissue. It still thinks it's in your body. And they were able to find 3 drugs that worked on me that way without knowing the sequencing or anything, and it was alectinib, crizotinib, and metformin. And alectinib meant I was ALK mutation, and the metformin we find interesting because he deals with every cancer, and he has a handful of patients on it, very few, but different cancers. But it's only a few of us respond to metformin. I don't know why the other cancers do. Apparently he thinks in lung cancers that up to 1/3 of adenocarcinoma could possibly have an STK11 mutation, which is sensitive to metformin. Yeah, we don't know for sure. I haven't been tested for mutations, but since I'm sensitive to metformin, we think I have that mutation. And I'm hoping that other lung cancer patients can find out if that might be something to benefit them. Perhaps it can make our targeted therapies last longer. I don't know, because it's not based on a clinical trial, it's just based on his lab. So I'm just trying to, throw everything at it that I can.
How's your treatment going?
I'm not fine. I take, 4 pills twice a day for the alectinib and 1 pill twice a day of the metformin.
What about chemo?
I don't do any traditional chemo. That's the other thing. In the lab, it showed I was resistant to all the other chemos. So if the alectinib stops working, I know the next step is not a chemo because he already showed in the lab it doesn't work on me.
That's very interesting.
Whose lab?
It's down in Long Beach, California, the Nagorny Cancer Institute.
Yeah, I'm familiar. Got it.
Hi, I'm Nancy. I was diagnosed in November of 17, although I probably had it way before then. My mother passed away in 17 as well, and I was sick what I thought was bronchitis right after that. And this is in Michigan, and I was raised with bronchitis every doggone winter. So this was nothing new to me, so it wasn't a warning bell. And but after I buried my mom, it was time to come home and take care of myself, and went in to be checked, and it came out with small cell, stage 4. And not only that, I have SIADH, which is more of a problem than the small cell. The cancer just decides to get rid of the sodium all the time. The last few months, I've been in the hospital 10 times. And they just can't keep my sodium in my body because the cancer just keeps getting rid of it. So that's more of a problem. So little by little, we're working on it. I got an electrolyte doctor who's awesome. She's in San Carlos. And then I have my oncologist and everyone else as a team, and they're all trying to figure out how to treat me. So I've been on chemotherapy since November of 17, and that's the normal small cell, which was carboplatin and etoposide, and was on that for 30 treatments, which is 2 complete cycles, and then I got toxic, and they sent me to Stanford for clinical trials, and I was waiting for that, but at that point, my sodium got so bad, ended up causing a stroke and ended up half out of it. So they decided I had to go back on some kind of chemo because I could no longer wait for a clinical trial. So I started a month ago another chemo, and this is every week. And now I had on Friday as well a CT scan, and it showed that nothing had changed since the last CT scan. So now the doctor doesn't know if he should keep me on this chemo, change chemos, or is the extra sodium I'm getting really working? I take 27 tablets a day of everything. So that took a little bit of getting used to swallow that many tablets, especially 14 salt tablets a day. But you cut them in half and you get through it. I just can't, I'm not allowed to really drink much water at all. I can drink anything else but water. Got to stay away from fluids. It's just another lifestyle. But while they still try to figure out what in the world to do with me. They just don't get people with small cells pretty rare on its own, but getting it with SIADH is even rarer. So anyway, I'm here, so I'm grateful you're all here. So thank you.
It's interesting.
Thank you for sharing that. My name is Will. I work for Genentech and really appreciate the opportunity to be here and to hear all of your stories. It really puts a personal face on all the work that we do. So thank you for having us and for the work that your organization does.
Excuse me, like Will, my name's David Cooling. I'm also from Genentech. I just want to say thank you for sharing your stories. This has been really amazing to hear just everything from you, straight from the patients themselves. Often we don't get to hear from patients, so it's very, very eye-opening and very worthwhile. So I just want to say thank you. Thank you so much. Also want to say Merry Christmas and Happy Holidays to everyone. Thank you so much.
So for those of you, I'm just going to give a quick little background on David. So you guys know that Nikki from Genentech used to be a staple in this living room every month, and David is her, I don't want to say replacement, that sounds, well, whatever. But anyway, so David is now really excited to work with us in ALCF and to hear all of your stories. And he's based in the East Coast, so he won't be able to come every month like Nikki did, being that she was here. But just so you guys can put a sort of swap the faces, and he's here for the same reasons she was. Yes, and he will be sure to sign in from DC if anyone wants to chat with him. No pressure.
We're not going to let distance be an issue.
Fred. We went this way. Okay, let's do it.
Okay, my name is Joanne. My husband is Robert. He's got diagnosed with stage 4 lung cancer. I'm so lucky because they didn't give him that much long to live, but it's going to be 5 years in May. Yeah, I know. I love my doctor, Dr. Dormany. I just can't even thank you. He's just amazing. But right now he just can't manage his pain. That's what I want to ask. Like, what do you guys do? They gave him stuff and he just can't manage his pain right now. So I don't know what other people take. They gave him methadone, they gave him all kinds of stuff, but he just can't manage his pain.
Joanne, have you guys met with a pain specialist, like an actual pain doctor? Or is it just your oncologist trying to?
Okay, 'cause Dr. Dormady is he's my savior. I swear to God.
I would talk to Shane about going.
He does. You know what he just gave him methadone.
Yeah, that's what I'm saying. I wouldn't use Shane for managing pain at this point. Dr. Dormady's job is to manage cancer. I think what you need to talk to him about is referring you to a doctor who is a pain specialist, and that's all they do, is work with patients, individuals.
Nothing is helping him right now. He's just
here.
You know, the problem is the body grows immune to all of these drugs you're taking.
Yeah, Robert. Go ahead, Robert.
Yeah, I haven't gone to a pain specialist.
I think that's the next step.
I have through my my GP. You know, we've done some work with a pain specialist with him, but I just never, I never followed up on it.
Yeah, follow up on it, because that's all they do. They will look at, they will, dot every I and cross every T to really try to customize an approach to managing your pain.
Correct. I've been able to manage it up until recently.
Yeah.
Recently it's bad. It's really bad. So I don't know what to do.
Yeah, that's it. Pain specialist.
Tina's turn.
Pain specialist.
Tina.
Shane will get you there.
Are you sick or are you just upset?
No, I am sick.
Oh.
But I hope I'm not contagious.
Okay. I'm still going to air kiss you tonight. Okay. Teasing.
Well, I don't know. My story is kind of boring, but in a very good way. Because I was diagnosed.
Right, there you go. There you go. There you go.
That was appropriate. Thank you. Yes, I'm the bubbles and burgers person. And I did just celebrate last week? I don't know. It was just recently I got a clean scan again, and it's been 8 years since diagnosis. So there is a lot of that up there. There is a lot of that. And this organization really brings that home for all of us patients. Well, I'll just tell you briefly my journey or whatever. But when I was diagnosed, I was tested for EGFR right away, and I tested positive, which my doctor at that time was really thrilled, and he said, "This is great, you're just going to take a pill the rest of your life." And I just go, "Oh, okay, that sounds fine." And so I started on Tarceva, and my main tumor in my right lung was shrinking, and then we had already decided to change medical insurance prior to my diagnosis, which was so serendipitous. But anyway, so then I had to go to another doctor. So that was kind of like my second opinion. And he said, "Oh, I don't know if I would have started you right on Tarceva. I think I might have done radiation first. But you're already on Tarceva, so just stick with it." Well, that just wasn't a very good answer for me. And so we were conferenced with people, and and they said, "Well, why don't you go get another opinion?" And we were led to Stanford, and the doctor that I met with there, he said, "Well, you're on Tarceva. We know that works for you, but I think that we could have a really good shot for long-term with chemo, with standard first-line treatment, chemo and radiation." And I said, "Okay, bring it on. I'm ready." So I did do that, and I've had clean scans since that time. But after my treatment was over, I did go back on Tarceva, and it was more like a maintenance thing. And so it's been working for me for 7 years. And then, yeah, it's pretty exciting.
Yeah.
Thank you, Genentech. The other little bit of news is I am in another little research study now, and this is so exciting. But what my part of it isn't exciting, but the study is very exciting. But I just had a friend in Houston, Texas with lymphoma, and he just underwent stem cell transplant. And so this is the new thing for lung cancer is they will take your blood to see if you're a candidate for something. I'm not sure what it is, but there's a very small chance that I have what they're looking for. But they are going to look at my blood. The next step is they look at your biopsy, and they're looking for something specific, which I don't know what it is. Then, if all the ducks were in a row, then they would take the T cells out of my blood, and all they say is they would change them. They're engineered. And they say they'll be changed, and then they put them back in my body, and then they will fight the cancer cells. It's the immune cells, and they will fight the cancer cells. So that is really, really exciting that that's even talked about now. So, and then I knew all about my friend that just went through the stem cell transplant. So I knew his whole treatment, step by step by step. So. Anyway, it would be a very similar process, and that's what's down the road there. So it's very, very hopeful for all of us. And I go along with Dave and Joanne, and Merry Christmas to all, and we'll see you next year, same place.
Thank you, Tina. And just a shout out for participating in studies and trials, because it's so important that we all give what we can.
Of course.
Yeah.
Sign me up.
I'm Rick, and I'm Tina's husband, and supposed to be her caretaker, but she takes care of me more than I take care of her. But anyway, this woman over the last 7 years has been amazing. She's been so positive and so, I don't know, I'm going to beat this, and she's done it for 7 years. So I think that word up there on the wall is what everybody has to look at.
Thanks, Rick.
You're right.
3B. Well, it was 4 at first, but then by the time I got to the third doctor, he said, "How do you like 3B?" And I said, "I like it a lot." "You could be 4+," and I said, "No, I'll take the 3B."
Yeah, it's back. Oh, hi, Fred.
Hello. So my name is Fred Palmer, and I was diagnosed with non-small cell lung cancer in October of 2013, and I'm currently on immunotherapy.
Boom.
You want me to say something else?
No, I love the way you tell your story.
How are
You're
you
doing
doing?
well.
How are you doing?
Doing fine.
Fine is good.
He's traveling.
Fine is good.
He's
Okay, so I'm going to put in a plug. I directed a concert in Palo Alto on December the 8th, and Bridget tells me it's going to be on Penn TV, Christmas Day.
Oh,
Christmas Eve, Christmas Day, so watch it.
there you go.
Yeah. Yeah. She liked it. Yeah.
There you go. That's
I just
great.
want to say Fred's the only reason we finish on time because he brings down the average.
Yeah. And oh, by the way, we have 22 minutes. 1, 2, 3.
No, we're fine.
Hi, my name is Katerina Milicevic. I'm not a patient. I'm actually here on behalf of my mom.
Oh.
Danielle's met my sister Yelena. We haven't had the opportunity to meet yet. I'm sorry. It's very new, but it's been very heartwarming. I'm sorry, I did not expect this to listen to you all, and I have a lot of hope. My mom was diagnosed right before Thanksgiving with non-small cell lung cancer. I'm still learning all the words. She started chemo and immunotherapy, so I still have to look at the words, how to pronounce this, carboplatin and Alimta with Keytruda 10 days ago. So last week was the first full week. She's had some side effects and we're all adjusting. But my sister, I got a recommendation from a friend, and my sister also did, for Danielle. And we kind of felt that was serendipity that we both heard about the foundation at the same time. And just when my sister met with you and came back and talked to us, it just filled us with so much hope. And I'm so thankful you're so close to us. So we're hopeful. In stage 4, I forgot to mention that. I ignore stages. I don't think about words like stage, aggressive, advanced, none of that. I'm like, it's a really bad pneumonia, whatever. We're going to get through and do whatever we need to do. Thank you. Thank you. So I just wanted to come on behalf of my family. My mom's not feeling too great today, and there's 4 of us, 4 sisters. I live in New York, but I moved back home to be here for how long it takes. And thank you for all of you for sharing. And we'll get through it.
Oh, pumpkin.
We will. I just want to make a comment, and I'm going to come give you a big hug when we're all done with this. And I actually just talked to your sister yesterday. Again, yesterday late afternoon. I know what it's like to be the daughter on the end of this, so I have a lot to say about it. So let's. Okay.
Totally did not think I was going to cry.
I think I was either. Thanks.
I thought you were a movie star.
I'm going to keep all of you in my prayers. We're doing a lot of praying, so I'll add. I've been keeping track of everyone's names, so all of you are going to be in my prayers.
How cute.
So.
Okay, my name's Eric, and I'm a caregiver for Solna, and she was diagnosed, well, they found a pure GGO in 2012, and it was about 9 millimeters then, and it is now 19 millimeters, and it's still a pure GGO, and for those who you don't know, that's a ground glass opacity, and on the CT, it just looks like a little bit of cotton on there, and there's no solid component. So here's the tough part. One doctor says, cut it out right now. Don't even wait. The next doctor says, yeah, it's grown slowly. Don't worry about it. You'll die of old age before anything happens. What do? It's very difficult. And we're just watching now, so I'm calling it a stage 0 because it doesn't have a solid component and it's not cancer yet. So what do you do?
Where have you guys been seen? Where are you being seen?
What?
Where are you being seen? Who are the doctors that are giving you?
Mayo and UCSF, seeing Dr. Jablon, who says, don't cut out any lungs that are still working.
Mm-hmm.
You know, if you don't need to, leave it there. So I'm voting for no surgery.
And there's no other health issues or anything like that?
No other health issues, no symptoms. So.
And it's 9 millimeters.
Yeah, so now it's 19 after
millimeters.
6 years. So it's doubled in 6 years. And so it's very, very slow growing. So this is the good news.
Yeah, you know that we're big fans of Dr. Jablon's here. He did my mom's surgery 14 years ago.
So he's one of the best, so I'm listening to him.
Yeah, you're in good hands with him for sure.
And he's a surgeon. If he's telling you don't do it.
Yeah,
he wants to. He thinks his hands are magic.
That's
so
what
the
they
person who
do.
says don't cut it is the surgeon, and the person who says cut it out right now is not a surgeon.
Yeah.
Right.
So this is the opposite of what we normally hear and normally expect.
He's a great guy, so.
So if the surgeon says don't destroy good lung tissue, that's kind of good thing. So stage 0 is what I'm calling it.
Hi, Francis.
Yeah, hi. It's been, this month, it's been 11 years for me. I was I had surgery in December of 2007, Christmas Eve. That was the best Christmas I had in a long time. And I had chemotherapy, 12 weeks, cisplatin and etoposide. About those scans, so it's been a long time for me, and I'm very happy that it has been all those years. About, I want to say 2 years ago, I talked to my oncologist and I asked him, maybe we should go to 2 years frequency in CT scans, because I just wanted to reduce the frequency. And that year, they saw something on the scan. And why I'm sharing that is it doesn't really matter. Whatever works for you, whatever you're comfortable with. For me, it's important to keep vigilant. And the fact that they found something, it turned out to be nothing. But the fact that they found something is actually, that's why we're doing scans, in case there is something. So I think it's important to share that with you. And about those statistics, the biggest thing coming out of statistics, aside from ignoring them, is actually reading them, and then it says something like 15% or 5% or whatever the percentage is. But those percentages, the surviving percentages, are also people that are surviving. And you can turn that around and say, and make that positive and say, I want to be in that 5%. It's me who's going to be the survivor in that percentage. So that's, yeah.
Thanks, Francis.
Okay, my turn.
Yes,
Hello, my name is Sheila Young Lebinsky. I actually was diagnosed in May 2017 with stage 4 lung cancer. Before I was diagnosed, it happened in March. I was just taking my dog out of my car, and I remember like a shooting pain coming down in my lumbar region. And I was like, oh my gosh, something is terribly wrong. I was taking him for a hike, and I didn't know what was wrong with me. So I ended up doing the hike. I thought if I push through it, you know, everything's going to be okay. So I pushed through it, and I wasn't okay. It was like another week, and I was still in really bad pain. So I finally said, okay, I've got to call Kaiser. I've got to talk to my doctor. So I ended up going to see my primary care physician, and he looked at me and he said, oh, he goes, well, you know, we're all getting older, you know, and, you know, the back pain, you know, it just happens. Here's some Flexerol. So I had some Flexerol, and I was like, I'm not going to take this Flexerol. So I was like, okay, it's going to get better. And then like a week later, it still wasn't better. And then I finally emailed him, and I said, hey, is there any way I can get like physical therapy, you know, because I'm not going to take the Flexerol. He goes, oh yeah, that's fine. I'll sign you up for that. So I ended up having an appointment on the end of March to have a physical therapy appointment. And that was like March 29th. And so March 29th, I went in, I did my physical therapy appointment. He had me on the bed, on the couch, like doing like a real stretch, like squeeze. He's like, wow, I've never felt back pain so bad like this, like, and like your muscles are all tense. And I said, oh man, this feels good, right? Actually, but I'm like, boy, but I'm feeling shortness of breath, and I've gained a lot of weight, you know, and I don't know what's going on. And then finally, he said, well, you got to talk to your primary care physician. So so the next day, I couldn't breathe. Something was definitely wrong. I was shortness of breath. And I said, all right, I've got to go. I've got to make an appointment. So I called my primary care physician. I talked to him, and he said, come on in. I want to see you. Come in at 3:00. So that whole day, I was like, I really was having a hard time breathing. But I finally did get in. And when I did, he did an EKG. He did blood tests. He ended up, he did like a pulse oximetry test as well to test my oxygen level. And he said everything was fine. And he said, just one last thing. He goes, tomorrow, go to the Vallejo Kaiser and take a dimer test. He goes, just do that tomorrow, and we'll see what the results are. So I did. So what happened was I went home. My husband was with me. We went to Sprouts. I still couldn't breathe. I was having a hard time breathing. And then that night, my husband was like, okay, I'm going to make dinner. And I was eating some crackers and cheese that was on the table. And I was like, and he goes, don't eat all that. He goes, because we're going to have dinner and I don't want you to fill up. And I said, all right, I'm just going to go lay down. I'm so tired. So I went down to go lay down. And I remember I went downstairs and I was like, oh my gosh, something's terribly wrong because I can't breathe. And I was laying down like laying down flat. And so I sat up like with the pillows propped. And then finally I ended up standing up, and I could see stars. And then from that moment on, the next thing I remember is my husband was like right in front of me, and he woke me up, and he's delegating like so calmly to my kids that are seeing this. And then he's got 911 on the phone. He's got the ambulance on their way. Basically, they all came in, the fire department, and I heard them say my blood pressure was like, I think it was like 60 over 30. It was like really bad. Like I had cardiac tamponade. So so they took me in the ambulance. They rushed me to the hospital. I went to the Kaiser, and when I went there, the doctors were like, they didn't know what was going on with me. I was supposed to be going to Hawaii that Monday, and all I know is that I said, well, I just got to get out of here, because they did the, what was it, where they drain the fluid out of your lungs, what is it? I don't know what it is. For some reason, I'm having a blank now, but thoracentesis. So they did that, and next thing you know, it was the journey to begin where like I ended up they admitted me. I was there for 5 days. They still didn't know what was wrong with me. They ran a cytology report on the fluid that they took out of my pericardia, because I had a pleural effusion, I had pericardial effusion. So all that stuff, they ran a cytology report, and when they did that, they found out that I had stage 4 lung cancer, and they found out that at that point, they didn't know that I was ALK positive. And so it's a long story, because basically what happened was I ended up with like several doctors. Like I had the pulmonologist, like we all did. Like once you're diagnosed, you get a whole team of doctors. So to go forward, so in June, I finally, they gave me an infusion of chemo. So I started with that, and then they found out like in June 24th, I got the call that I was ALK positive. And it was like the best news ever, because then I could be on pills, and then I'm on 8 pills a day. And so far it's working really great. I haven't had any bad side effects or anything like that. And so far I'm hoping that I can continue on it until the next targeted therapy.
What drug are you on? Oh, were you going to ask?
It was alectinib.
Yeah. What was the time frame from the moment you started having all these symptoms to actually getting a genomic test and diagnosis?
The time frame for when I was doing it all, it was probably so May 4th. So what had happened was the first biopsy that they had done in April 30th, they didn't take enough tissue.
Yeah, but I'm saying from the time you were symptomatic, had to be rushed to the hospital in an ambulance.
When it started, how?
From your walk.
So when did it? Like as soon as when I ended up getting the first genetic testing.
No.
When did you leave it? The ambulance. When did the ambulance happen?
Ambulance, diagnosis.
So the whole thing, so May 4th is when I was finally diagnosed with stage 4 lung cancer.
Okay, but what I want to know is when you started to be symptomatic, you know, shortness of breath and all, you said, I know
Oh, that
something.
was not that long. That was like literally, that was maybe like, no, that was only like a couple weeks.
That's
Oh,
good.
okay.
So it was
Okay.
May 4th of
Basically.
this year
So
or last year?
last year, so it's a year and a half. It's been a year and a half, yeah.
So they were.
Yeah,
And I had originally I was diagnosed for, they said I was supposed to like die in 6 months. And here I am.
But you didn't stay with your original.
No, I didn't stay with my original oncologist. I switched. And actually, I got a second opinion with Dr. Heather Wakely in Stanford. And she's amazing. She saved my life, basically. Say it again. I ended up going to Hawaii a year later. We did go to Hawaii. I know. It was a journey. It was a long journey.
Well, welcome. We're so happy to have you here. I think this is your first time. Hi, Rosalind. I see you.
Hi, everybody. So my name is Rosalind Spruitt. I am Francis's wife and was his caregiver when he was ill. I just want to say that for everybody here, since Francis was diagnosed, it really brought lung cancer into a really sharp focus for me personally because I realized, I mean, I knew I had an uncle and 2 aunts, or at that time I had an aunt and uncle who died of lung cancer, but I really didn't pay attention to the fact that they had died of lung cancer. They had cancer. It was just a generic thing in my mind. After he was diagnosed, I had another uncle who died of lung cancer. But I've had many more people. My ex-husband's mother, a former coworker, my son-in-law's mother died when he was 16, several years back. A former high school friend of my husband. The list actually goes on quite long for me personally. So when Francis was diagnosed, we ran into some folks with another lung cancer advocacy group. We hadn't heard of Bonnie's group, so we started advocating for lung cancer patients through that group. We've been to DC several times. And I just want you all to know here that there are people like us who very actively go out to events. We go to DC because we want to advocate at the legislative level, because that's really, really important. And Bonnie and Danielle and Andrea and Michelle have all joined us there. And it's a really great experience. But we do this because we know how important it is. We know how the lack of information and awareness about this disease has kept the research back, has kept the advances back. So for us, for my husband and I, it's become very important to be active that way. And we do it because we know that we should have a lot higher survival rate, and we can have that if more people become very active in advocacy, because that's what moves the needle. So I really want to advocate to everyone here, to everyone at home who's watching this, if you have any time to write a letter, any time to make a phone call to your representatives, if you want to know what's going on at the legislative level, call Bonnie. And there's other organizations out there too. Find out what they are trying to get passed, what acts are actually active at the moment that you can call about and say, please, to your congressman or senator, please put your name on this bill, put your name on this action, become part of the lung cancer caucus that's now currently just recently started in the Congress.
Yeah.
So
This is probably a fact you already all may know. Maybe you don't. Lung cancer is 30% of all cancer.
And there's between
That's huge.
solid tumor and blood, there's over 100 different cancers.
Yeah. But it's the least funded cancer. Least funded. If you look at breast, colon, and prostate, the survival rates are 80, 90%, 99% because of funding, because of research funding. And lung cancer is 30% of all cancer. We don't have to sit and talk about why, but we have to do something about it. We have to do something about it.
It's about moving the needle.
It's going to take grassroots because
it
no
is.
one else seems to care.
And it's about creating a movement, to Rosalind's point, and she's talking about the Lung Cancer Alliance.
Exactly.
And I was out there last year with them up marching on the Hill, and as were you and my sister. It was fun. We had a great time. And you guys know we work closely with the LCA, and if you want more information on how to do this kind of stuff, we actually invited them out this past year to do a living room solely dedicated to legislative sort of advocacy and how to participate,
Policy and
how to write the letters and that sort of stuff. So I encourage you to go to the our video archive, and Elridge came out and she did a great job sort of explaining the process. And literally sometimes it's just as easy as a click of a button, but we really do have to create that groundswell of people, you know, to get behind what.
Can I tell you what I want? Can I tell them what I want?
I want you to tell them
and
what you
online,
want.
I want $20 from 1 million people.
Oh man, I knew you were going to say that.
Everybody has $20, right?
I want you to hit that button that says
$20
stop.
from 1 million people.
I want you to hit that button that says stop. Can you see it?
Which one?
I don't know. Just start hitting buttons. Start hitting buttons.
And just real quickly, we've heard from the people
There you go.
on,
You gave us another hour.
That's
on
what I
the
do
Hill
on
in
TV at home.
DC.
Jenny, just take it. Thanks.
We've heard from the people on the Hill in DC about how in October you see nothing but a sea of pink.
Right.
And we need to see a sea of whatever, I mean, what color are we using? I mean, but we need to see the people. We need to see
Hopefully
the
not clear
people
anymore.
there in whatever month, you know, whatever group decides to go.
Yeah.
We need to go there en masse. We need to show up in their offices, and we need to say, we want a survival rate of 90%.
Yeah, exactly.
And that's what we're looking for.
Yeah. And I want a big hoorah for that. Like when we're done with this meeting, because I think it's a very, very, very important point to make. What I also want to do is be mindful of time, and I have a couple of things that I must do.
Housekeeping.
Some housekeeping.
Okay. What she's doing is telling me to be quiet. That's what she's doing.
What I mostly want to do is apologize to the people online who maybe didn't get to say hello, unless you have a quick, like, minus the stories, like anybody who, no. So, yeah, and sometimes they don't want to, huh?
They did say that everyone's thinking of you.
Dave? Oh. So I apologize that we didn't get to the online folks either on the, yeah, and that's typically, for those of you who don't know how it works, we're all doing this in the room amongst ourselves, and they're doing the exact same thing in the chat online here and on the Facebook stream. So we literally have 3 different sort of groups happening all at the same time, talking at the same time about the same thing. So even on the months when we have speakers in the room, they're discussing it in the room just like you all are just discussing it here. So it's really kind of a cool little trifecta. So
What are we doing next month?
Yeah, that's part of my housekeeping.
Okay. Say that first.
Jeez.
Say that first.
So housekeeping, next month's living room, is going to be about navigating the latest advances in lung cancer treatment. And one of the interesting things we're going to do is we're going to have a patient panel, and we're going to have a patient representing each of the targets that have an approved therapy for them, including immunotherapy and chemotherapy. So we're going to have representation sort of across the board and talking about what that looks like and some of the things that were kind of brought up today. So I think it's going to be a really exciting and great living room. So that's January's living room. Events, because I always have to talk for our folks, especially the ones online who might be tuning in from this area. or these areas. February 10th, our 5K walk run in San Dimas, California. So if you're in Southern California and you want to come out for a day of celebration, nobody's going to make you run. You can walk. You can not do anything. Just
Have
come
champagne.
and just come. And yeah, you can bring champagne. Come and just sit. I'm not supposed to say that out loud. Well, you're not supposed to say that out loud. It's a great day to come and kind of group together like this, but in a different environment out in the park. So February 10th, San Dimas. February 24th, Peoria, Arizona. Same thing, our 5K walk run. March 2nd in Gainesville, Florida. That's Run Amok with the Duck. Plenty of you have met Karen Gorenberg, who's been here in person, who's from Gainesville, Florida, who spearheads that event out there every year. So if anyone's out there and wants to join, please do. Endurance runs. So not that I expect, well, I mean, I don't know. It's not that it can't be done. March 3rd, it does happen all the time. Patients running these marathons. I can't even run out to my car. So I don't understand it at all. But March 3rd, Napa Valley Marathon, half and full marathons. We still have bibs available for that. If anyone here and or you know anyone or anyone watching who knows someone that is interested in doing this sort of thing, we still have availability for Napa Valley Marathon, as well as the March 19th New York full marathon. The half marathon bibs are sold out, but the full marathon's still available. Now I'm going to do my thank you. Well, before I do my thank yous, what I want to say is I was taking like feverish notes tonight about a multitude of things, but one of them, one of the things I was looking for was sort of themes in the conversation, right? Because Michelle and I are trying to plan and put together what this event is going to look like next year. And one of the things we had anticipated doing, but we didn't have time to do, was actually ask you that question, right? What's working, what's not working, what do you love most, what could change, topics, speakers, so on and so forth. This type of an environment where in 2018, believe it or not, this is the one and only strictly patient roundtable we did, because it's gained so much popularity with speakers and key opinion leaders that they want to come here and talk to you guys about what's happening in the space, and it's happening fast and furious, right? But one of the definite things I learned tonight is how needed this type of an environment is, because we took up 2 hours plus doing nothing but sharing stories and encouraging and providing hope to one another. So that's sort of the overarching thing that is my takeaway from tonight. So I just want to.
And for our guests, they see that all of these patients are uniquely different.
Yeah.
Very different.
Yeah. A couple of other themes were staying healthy during treatment and maintaining hope. I mean, I heard that throughout everyone's story, how important keeping your head in the game and keeping this in your head, regardless of what you may or may not be feeling or being told, or what your scans may look like. Yeah, thanks, Jen. So for those of you, and Fred and I talked about this a little bit earlier, who haven't had the opportunity to participate in our lung cancer registry, if you guys want more information about that, or how the information that you guys can report back on what's happening with your cancer from beginning to end, basically the stories you told tonight, but on paper. It's an open sourced platform where we're sharing this information with researchers and people out there really trying to get to the bottom and find commonalities with what's going on with everybody, so that they can do smarter research moving forward. So we highly encourage you to participate in that. Do you want to interrupt me?
No, I just wanted to say, because, we do have some new people in the room. They need to sign a little paper, because you're going to be on TV tonight and for an entire month.
This should have, well, hopefully you signed it on the way in.
Did everybody sign up? Did everybody sign a paper?
If not, we'll catch you on the way out, or else we'll do that really weird fuzzy thing.
Okay.
If we have to. Yeah, and so
that's good. Yeah, right, you're good.
And so Sandra, who's the
can't
director
find
of the
it.
registry, is here tonight. So if anybody's interested or has more questions, I know Fred and I talked about it because he's on immunotherapy right now, and there is a separate immunotherapy study that we're doing with the hospital in Florida and Pennsylvania. So anybody who wants more information, please, please, please reach out to Sandra. I saw you sneak in. Arash showed up. I saw him sneak in.
Look who's here. Did you bring a cake? Ron left, no cake.
So
Rosh
to
says
finish the
no
thank
cake.
yous, Peninsula Television, who comes in here every month, sets up these cameras. For those of you who it's your first time, if you haven't seen everything they've set up in this back room that goes along with these people that are sitting out here, I highly recommend you do, because I give them huge kudos and applause for setting it up, hooking up with our Ustream Live, so that we can bring this not only to you guys in the room, but to those around the globe who want to come back in and listen. And you want to I see.
I just want to interrupt one more time. Because if you peek in that door out there, they brought an entire television station here. You are all on TV. If you live locally, check out Channel 26. And Can't Sleep Tonight, you're going to watch yourselves. You're going to all watch yourselves on TV. And this will go on, this particular living room will go on for about a month, right?
Yeah.
On TV at various different times.
Yeah, I want it rotate every month. They'll play the same one over until we do the next.
Until we do a new one. Yeah.
I want to give a huge shout out, and I don't see her, so I'd like somebody to bring Kim Shapoister. Here she comes into the room. Kim has worked. She's gone above and beyond, as she does every month, but particularly this month, to bring holiday cheer and something a little different to the table. So she is personally responsible for all of the food, including Evangeline, who some of you who have been here before know Evangeline. She's a patient. She's been coming for about 3 months now. She's since her very first meeting, comes in about 3 days a week and sits and works with Kim behind the desk and helps out where she can. And she was mashing potatoes today for all of you. She had to leave early, but a huge thank you to Kim for the potato mashing and the ham and the turkey and all of that stuff.
This is a home-cooked dinner, a home-cooked dinner.
Sally, Miss Sally, for dessert on the back table.
Did you bring the coffee cake?
Why does everybody keep asking about the coffee crunch?
No.
And last but absolutely very not least, I want to give a thank you to our sponsors, without whom we could not bring this to all of you each and every month. So forgive me while I read this list, but it's too long.
That's the good news.
That's how important they think that this program is. So AbbVie, Amgen, AstraZeneca, Boehringer Ingelheim, Bristol Myers Squibb, Celgene, Genentech, Lilly Oncology, Medtronic, Merck, Novartis, and Takeda Oncology. Thank you, thank you, thank you for your support in this program.
Can I interrupt you one more time?
You're gonna.
Okay, so I just want to tell you about Danielle and what she and Michelle are doing. They are literally.
Oh, I didn't know you wanted to interrupt to talk about me.
Yeah, right, exactly.
Hold on.
So, are you going to say you're sorry?
No, I'm just going to sit back.
Okay. So, they're going out, aside from doing this once a month, and, none of this is easy to get this done and come up with, things to talk about and stuff. They're going out on the road and doing them at our different hospitals. And, I personally did one at Yale. And
Michelle did it, yeah.
Michelle and I did it. And, they've never seen a support group. They don't even have support groups. It is not common for hospitals and whether they be a community hospital or a major hospital to have support groups. So we do it, and it's become something we're just so very proud of, and it's very productive, and it's patients teaching patients. And patients teaching physicians, because when we all get together and physicians are in the room and pharmaceuticals are in the room, or whomever our partners are, everybody's learning.
Yeah, it's true.
Everybody is learning.
It's very true.
There's never a dull moment.
Very true. And finally, and then we'll all go eat cake and have more wine. A big thank you to the doctors and the care teams out there who are getting it done for all of you and all of those yet to be diagnosed. A huge, huge, huge thank you, particularly this holiday season, to them. Caregivers, family, and friends of loved ones with, living with lung cancer right now, and most importantly to the patients out there. Thank you all particularly for your courage in this type of space to be able to share your stories with one another, not just here in the room, but with all these cameras and people literally around the globe, 144 countries to be exact, who have tuned in to watch this program. So thank you, thank you, thank you, thank you. And we will see you all in 2019.
No, we will see you all next year, same time, same seat.
That's what I said.
Right, you said see it in 2019.
Well,
That's
2019
next week.
is next month.
2019 is next week.
God, she always has to correct
Same
me.
time
She's always a
next
mother.
year.
Always a mother. Sally, did you have a question? Sally needs a mic because she has a question.
This is just amongst us. Oh, okay. Knowing that Penny Marshall died today and knowing she did a PSA for us, they say she died from diabetes. Do you know what part lung cancer played in her death?
I don't.
Well,
I know she was diagnosed with lung cancer.
I know, and she did a PSA for you.
But she also said, you know, in all of the talk about Penny dying today, that she did, every single one of them mentioned that she conquered lung cancer.
Well, nothing I read when it first was announced earlier today mentioned it.
It was. I mean, they didn't say she died of lung cancer. She died of complications
but
with
they
diabetes.
did mention that
They
she-
totally mentioned it. Every
Right.
single thing I heard.
Not that I'm glad she had it, but I just was curious when
I don't
I
know.
saw
I've been in meetings all day, Sally. I don't know. I have no idea.
I watch TV all day while she's in the meeting, so.
This one was on CNN.
I get the news.
I was, in meetings. Thanks, everybody. Please come eat more food, grab some dessert. Let's enjoy the rest of the night.
We're good.